Hello. My name is Monica Brinzak from the Department of Public Health, BBU Cluj-Napoca, Romania, and we are one of the Be Well project partners. It will be my pleasure to be your trainer today. This training module will provide you with skills for critical thinking. What is critical thinking? The importance of critical thinking for health and care operators. How to develop and use critical thinking. What is critical thinking? Critical thinking is an active process that enables each of us to assess our own actions and accomplishments. Making little mid-course modifications to one's thinking is another benefit of critical thinking, as opposed to reacting to adverse events. Critical thinking has long been incorporated into the curricula of allied health and nursing educators. However, critical thinking has not yet been properly included into medical education curricula. For healthcare practitioners to become well-trained, critical thinking abilities are crucial. These are talents that must be learned, not taught. Critical thinking is also defined as a goal-oriented, purposeful mental activity involving a number of intellectual skills such as analyzing, making inferences, clarifying ideas, and evaluating the credibility of sources to make accurate clinical nursing judgments. It is both an attitude and a reasoning process. In literature, critical thinking is often used, and perhaps confused, with problem-solving and clinical decision-making skills and clinical reasoning. In practice, problem-solving tends to focus on the identification and resolution of a problem, whilst critical thinking goes beyond this to incorporate asking skilled questions and critiquing solutions. Critical thinking is based on universal intellectual values, such as clarity, accuracy, precision, consistency, relevance, sound evidence, good reasons, depth, fairness. The importance of critical thinking for the health and care operators. Critical thinking itself is not part of the academic curriculum in medicine or public health. Being critical, however, is a trait that seems to be desired in healthcare professionals and emphasized in documents that describe medical thinking. A common example for the importance of critical thinking in the health and care processes is within nursing. A nurse is usually the first to notice changes in a patient's status because they are their primary point of contact. Interpreting these developments without judgment and with a wider analytical lens is one way that critical thinking can be applied in nursing. Make unbiased conclusions by basing them on the facts. You can improve the standard of care and results for your patients by using critical thinking abilities to anticipate and comprehend their requirements. Critical thinking consists of some particular components which should be incorporated by nurses and other health and care operators into their practice. Clinical judgment. Set a patient's care demands in order of priority and adapt as circumstances change. Make use of your critical thinking abilities to evaluate test findings and the significance of the patient's clinical presentation, including their vital signs. Next, order the interventions according to priority and foresee any problems. Patient safety. Take steps to keep the patient safe. Let's say you don't believe a patient should receive a different drug as part of their treatment. Some clinical decisions are quite difficult, but you can always use critical thinking to make sure that their advice and treatment is the most suitable to the person's needs. Cooperation and communication. While avoiding passing judgment, actively listen to people and pose pertinent questions. Fostering a cooperative atmosphere could result in better patient results. Problem solving. Developing your problem-solving abilities will help you think more critically. Examine the issue, weigh your options, then put the best answer into practice. Some skills are more important than others when it comes to critical thinking. The skills that are most important are interpreting, understanding, and explaining the meaning of information or a particular event. Analyzing, investigating a course of action that is based upon data that is objective and subjective. Evaluating, this is how you assess the value of the information that you have. Is the information relevant, reliable, and credible? Based upon those three skills, you can use clinical reasoning to determine what the problem is. These decisions have to be based upon sound reasoning. Explaining, clearly and concisely explaining your conclusions. The nurse needs to be able to give a sound rationale for their answers. Self-regulating, you have to monitor your own thought processes. This means that you must reflect on the process that led to the conclusion. Be on alert for bias and improper assumptions. How to develop and use critical thinking. Critical thinking in healthcare involves the ability to analyze information, evaluate evidence, and make well-reasoned decisions in complex and often high-pressure situations. Here are some examples of using critical thinking in healthcare. Diagnosis evaluation. Physician reviews a patient's symptoms, test results, and medical history. Instead of accepting the first possible diagnosis, you can consider multiple possibilities, differential diagnosis, and weigh the evidence, looking for inconsistencies that could suggest a less obvious condition. Risk assessment and treatment plans. A nurse caring for a post-operative patient notices subtle signs of infection. Even though the patient's temperature is within a normal range, the nurse critically evaluates other symptoms, such as increased heart rate and altered wound appearance, to assess the risk of sepsis and escalates care. Medication administration. Before administering a medication, a nurse reviews the patient's allergy history, the prescribed dose, and any potential interactions with other medications. If something seems off, e.g., the dosage seems too high, the nurse questions the order and consults with the prescribing doctor. Patient-centered care. A healthcare team discusses treatment options for a patient with multiple chronic conditions. Critical thinking is used to weigh the benefits and risks of different therapies, considering the patient's preferences, values, and lifestyle, to develop a personalized care plan. Ethical decision-making. A doctor faces a situation where the treatment options for a terminally ill patient may prolong life but reduce quality of life. The physician critically evaluates the ethical implications, consults with the patient and family, and considers the patient's values before making a recommendation. Interdisciplinary collaboration. During a case conference, members of a healthcare team, physicians, nurses, social workers, and physical therapists discuss the best course of care for a patient. Critical thinking is employed as they analyze data from different perspectives and collaboratively develop a cohesive treatment strategy. Error prevention. A pharmacist reviewing a prescription noticed that 2 medications prescribed to a patient could have adverse interactions. Using critical thinking, they verify the necessity of both medications and consult the prescribing physician to adjust the treatment and prevent potential harm. In relation to the nursing process, Fashion, Preferto McGrath, and Wilkinson have identified the core critical thinking skills and grouped these skills according to the stages of the nursing process. As well, these authors have associated to the respective critical skills a set of effective dispositions of critical thinking, listed in the following table. Papp et al. Have identified 5 stages of critical thinking, which can help you in assessing your acquired level of critical thinking skills. Stage 1. Unreflective thinker. A single approach to gathering and processing information based on crude scripts. Stage 2. Beginning critical thinker. A beginning critical thinker sporadically uses different approaches to thinking and is able to gather information in a focused manner. The use of a limited number of approaches may lead to incorrect conclusions or to include only the most likely explanations for observed phenomena, but disconnecting theory from practice and not applying them in action increases the difficulty of becoming a critical thinker. Stage 3. Practicing critical thinker. A practicing critical thinker can articulate multiple approaches to problem solving and use established principles to make sense of observations and guide decisions. Stage 4. Advanced critical thinker. Uses intuitive and analytical strategies interchangeably to solve problems, adjusts thinking, and avoids cognitive biases. The professional shifts their thinking and approach towards problem solving, in line with fundamental principles and concepts, such as fairness, integrity, or evidence-based reasoning, that shape decision-making. Stage 5. Accomplished critical thinker. An accomplished critical thinker displays critical thinking to others and demonstrates the ability to toggle efficiently between analytical and intuitive approaches. They elaborate complex connections between basic principles to create plausible hypotheses to explain observed phenomena. They have the ability to create new knowledge or understanding by reasoning inductively in this way. As homework, please think at the model of 5 stages of critical thinking and identify in which stage you are. Make a list of skills you should develop and trainings to follow, so that you advance in this 5 stages model. Now, for the reflection moment, please think of a situation when you are asked to replace for a day your team leader/supervisor. Would you change something in your usual approach of handling a patient? Why? We are now at the end of the 3rd module, Critical Thinking Skills for Health and Care Operators, of the course Develop Resilience for Health Operators. Thank you.